Okay, let's dive right into this explainer, where we're going to unpack the practical, strictly medical reality of mindfulness to help you find some grounding in life's everyday chaos. Look, if you've ever felt like mindfulness is just some trendy buzzword or maybe something reserved exclusively for monks sitting on a mountaintop, you are absolutely in the right place. Today, we're looking at it through a purely clinical, evidence-based lens. We're exploring the mindfulness-based stress reduction workbook to see exactly how this practice has evolved into a highly respected, medically recommended therapy. We're starting off with this really poignant thought from the poet Rumi, which is actually featured right in our source workbook. And honestly, it sets the perfect stage for our journey today. Human nature dictates that when something hurts, we look away. We distract ourselves, we numb it, we try to outrun it. But this quote highlights a core truth of mindfulness: accepting our pain, actually keeping our gaze on the wounded place rather than constantly trying to avoid it, is the only real way that feeling or light can enter.
So, here is our roadmap for this explainer. We'll start with waking up to life, move into the science of mindfulness, discuss taking the oars, and wrap up with some practical everyday exercises. Let's jump right into part one: waking up to life and the missing now. This concept brilliantly illustrates the human tendency to live literally everywhere except the present. Think about it. We're so often one step ahead, our minds are racing with anxiety, we're caught up in hectic activity, and we're constantly trying to manage tomorrow instead of just experiencing today. Or on the flip side, we're one step behind, dwelling on the past, placing blame, or fantasizing about what once was. Either way, living like this leaves us completely drained, and we repeatedly miss the only precious moment we actually have, which is right now. Now, you've got to appreciate the wry humor of the full catastrophe. This is a quote from the novel Zorba the Greek, and the founder of modern mindfulness, Jon Kabat-Zinn, famously used it to describe the human condition. When Zorba is asked if he's ever been married, he says, wife, house, children, the whole catastrophe. The point here isn't to be cynical at all. It's to acknowledge that life consists of much more than just perfect, uninterrupted happiness. Everyone experiences elements of the catastrophe. It is universally shared and unavoidable. The goal isn't to escape the catastrophe, but to learn how to exist within it. Moving right along to Section 2, the science of mindfulness, looking at its medical roots and evolution. See, mindfulness isn't just a philosophy. It's a clinically recommended therapy developed over decades to treat real physical ailments. Back in 1979, biologist Jon Kabat-Zinn developed the Mindfulness-Based Stress Reduction Program, or MBSR, at the UMass Medical School. He wanted to see if the focus and clarity he found in his own practice could actually help hospital patients manage severe pain and chronic illness. And you know what? It worked incredibly well. Fast forward to the late 90s, psychologists adapted this into mindfulness-based cognitive therapy, which was proven to reduce the recurrence of severe depression by an astounding 50%. Today, this therapy is used globally to treat severe, debilitating stress disorders. To really understand its modern application, we have to look at bodily distress syndrome. This involves physical symptoms like periodic headaches, chronic fatigue, fibromyalgia, or unexplainable chronic pain that don't stem from any known physical or psychological disorder. It shows us how intense mental stress and that severe lack of presence we talked about can actually manifest as debilitating physical pain. The nervous system becomes so imbalanced by constantly living one step ahead or one step behind that the body literally starts ringing its alarm bells through physical suffering. Which brings us to Section 3, taking the oars and empowering yourself. This is Dr. Lone Overby-Feuerbach's clinical workbook, and it forms the evidence-based foundation of the therapies we're exploring today. Dr. Feuerbach is a psychiatrist and researcher who works directly with patients suffering from those severe, chronic stress disorders. What she's done is take the historical practices of mindfulness and distill them into an actionable 9-week clinical program designed to fundamentally rewire how we interact with our own thoughts and symptoms. I absolutely love this metaphor, which actually comes from one of the patients in the text. This patient had been terribly ill for 5 years, and when they were finally accepted into Dr. Feuerbach's program, they said finding this therapy felt like being pulled into a lifeboat after drowning in a sea of chronic stress. But here is the kicker. You are immediately handed the oars to do the hard work of rowing yourself to safety. No one else can row for you. Mindfulness isn't a passive pill you just swallow. It's an active, ongoing practice of taking responsibility for your own mind. All right, let's get into section 4, practical everyday exercises. We're officially handing you the oars.
First up is the small meditation. The instruction here is remarkably simple, but executing it, that's incredibly difficult. The goal is to just sit still, feel your body breathe naturally, and accept whatever thoughts arise without judgment. You don't try to change your breathing at all. You just observe it. And the exact moment you realize your attention has drifted off to your grocery list or some argument from yesterday, which it inevitably will, you simply notice that and gently pull your focus back to the breath. That gentle refocusing right there, that is the actual mental bicep curl.
Next, we bring the physical body into it with the mountain pose. You know, young children naturally sit and stand with perfect poise, but as we grow up in modern society, constantly hunched over our desks and our phones, our spines compress. We literally start to hide our stomachs and cave inward. This pose corrects our compressed modern posture and reconnects us with our body's natural space and dignity. It's simply about standing with parallel feet, a balanced spine, and just feeling what it's like to take up your rightful space in the world. Because posture deeply, deeply affects the mind. Now let's break down the famous Raisin exercise. This perfectly demonstrates how slowing down a totally mundane, everyday action can become an intensely grounding meditation. You take a single raisin. First, you look at it as if you've never, ever seen one before. Second, you touch it, really feeling its texture against your skin and your lips. Third, you actually listen to it near your ear. Fourth, you taste it, rolling it on your tongue before softly biting into it. And finally, you swallow, consciously feeling your body become exactly one raisin heavier. It sounds a little silly at first, right? But it forces you out of autopilot. If we rush through eating without tasting, imagine how easily we rush through our lives without truly seeing our families or experiencing our days.
Following that is the body scan. This is a core technique where you systematically direct your attention across your body, starting from your toes and going all the way up to the top of your head. Now, the point isn't necessarily to force yourself to relax. It's actually a way to learn your physical limits and find comfort right where you are, even if what you find is tension or discomfort. You're mapping your physical reality in the present moment, rather than living purely up in your anxious thoughts. As you practice these exercises, mastering these vital, non-judgmental attitudes is the true goal. Accept what you see, even if it's unpleasant. Treat yourself with affection. Do not force calmness. Observe passing thoughts with warmth. Let go of self-criticism. Basically, don't fight the restless thoughts. Just observe them warmly. The mind is naturally going to generate a constant stream of critical thoughts, judging the weather, your colleagues, yourself. Mindfulness is simply noticing that judgment happening and choosing to greet yourself affectionately anyway. We conclude the first week's practice with this direct exercise from the workbook called Why Mindfulness. It asks you to sit with your breathing for a few minutes and deeply reflect on your personal motivations. Because it's not enough to just go through the motions, you have to anchor your practice to a deeply personal why. So I'm going to leave you with this final, provocative question from the text to ask yourself right now. Why are you watching this explainer, and what do you actually want for yourself? Are you tired of living one step ahead? Are you exhausted from being one step behind? Remember, only you can grab the oars. Take a moment today to step out of the catastrophe, take a single deep breath, and begin your own mindfulness practice. See what happens when you finally wake up to the present.